I'm Dr. SabrinaAtwal, and I'm here with Elizabeth Din, who's presenting to clinic to get teeth number 3 and 20 extracted today. Hi Elizabeth, how are you today?
Good.
What brings you in?
I've actually been having a lot of pain in the upper right and the lower left of my mouth.
Oh, I'm so sorry to hear that.
Yeah.
All right, so we'll start off with just doing some medical history.
Okay.
So, just a few questions I'm going to ask you. So, any new medical issues since the last time I saw you?
No.
No? Perfect. I see no new allergies.
Mm-mm.
All right, any new medications?
Nope.
Excellent. Are you pregnant?
No.
Do you have any vascular disorders that you are aware of?
Mm-mm.
Perfect. Any past problems with local anesthesia?
No.
Excellent. The reason why I asked the patient if she was pregnant or if she had any vascular disorders is because if she had said yes to either of those questions, we would have to defer extraction treatment. After I've completely reviewed her past and current medical and dental history, I looked at her radiographs and determined that tooth number 3 and 20 cannot be saved and need to be extracted. So Elizabeth, today what we're going to do is we're going to extract your upper first right premolar and your lower left second premolar.
Okay.
So just before we get started, I'm going to get you to sign this consent document to consent for all the procedures that we will be doing today.
Okay.
Perfect. So before we get started, I'm just going to take your vitals and your blood pressure. Okay, so this is our basic setup for local anesthesia. We have protective eyewear, gloves, and a mask. We have our tongue depressor here. We have topical anesthetic made of 20% benzocaine. We have cotton pellets. And we also have some syringes and short and long gauge needles and 1.7 milliliter carpules that contain 2% lidocaine and 1 in 100,000 epinephrine. So to assemble the syringe, I'm first going to pull back the thumb ring, insert my carpule, take the needle, insert the short end into the syringe and secure it, and then push down on the thumb ring to engage the harpoon into the carpule. Now we're ready to deliver the local anesthetic. For filming purposes, I will not be wearing a mask or goggles, but in a real case, I would. So I'm going to position myself as positioned here, slightly behind the patient. I'm going to place my thumb into the patient's cheek to retract it. I'm going to look for the coronoid notch, and once I find it, I'm going to place the needle over the plane of occlusion, over the first premolar on the contralateral side. And then I'm going to inject the needle in front of the pterygomandibular raphe. I'm going to insert the needle until I hit bone, and then I'm going to pull the needle back a little and aspirate. If there is no blood, then I can continue to inject the anesthesia. So now we're going to start with the long buccal nerve block to anesthetize the buccal surfaces of the posterior molars and the second premolar. So we're going to start by opening the patient's mouth again, retracting the cheek, placing the needle parallel to the posterior molars, and we're going to insert the needle along the distal and buccal surface of the last molar in the mouth. We're going to insert the needle 1 to 4 millimeters, and then we're going to aspirate and make sure there's no blood, and then we'll finish the carpule. So now we will do a maxillary infiltration. We're going to be using a 30 short gauge needle for this injection. So we'll start by retracting the patient's cheek, placing the needle at a 45-degree angle towards the root of the tooth, and then we will inject. Once we have finished with injections, we have to disassemble our syringe. So we'll be using the one-handed scoop technique to cap the needle. Then we're going to disengage the harpoon by pulling back on the thumb ring. The carpule and needle will both be discarded in the sharps container. The syringe will go into the red bag, and it will be returned to the dirty side of the supply counter. Once we have determined that the anesthesia has set in, we can start with the extractions. First, we'll go through the extraction instruments that we will be using, including an elevator, forceps, and a Minnesota retractor. The elevator is used to expand the buccal lingual shelves and loosen the teeth. They can be used as wedges, levers, or a wheel and axle. There are many different kinds of elevators, but the most commonly used are the straight elevators. Make sure to always use a finger rest with adequate control to avoid damaging surrounding structures. Coming at a right angle to the long axis of the tooth when using the elevator, towards the CEJ, turning the elevator in a counterclockwise direction. Once the tooth is elevated, the forceps are used to luxate the tooth and remove it from the socket. Using the hemostat and gauze, apply pressure to the site of bleeding. This is done to control the bleeding. The Ronger instrument and bone file is used to recontour the bone. It is very important to irrigate the socket using mono-inject syringe with saline solution. Use a needle driver to suture the papillae or flap. So once the procedure is complete, we want to make sure the patient is comfortable and has no pain or concerns, and then we're going to give them some post-operative instructions. So Elizabeth, how are you doing?
Good.
Excellent. So before I send you home, I'm just going to give you some instructions. So for one, I'm going to send you home with some gauze.
Okay.
So what I want you to do with that gauze is just apply it to the extraction site with as much pressure as you possibly can. Try to keep it in for at least 30 minutes at a time before switching it out, and that's just going to better your healing.
Okay.
Next, if you do feel any pain at all, feel any discomfort, over-the-counter pain medication is fine, such as Tylenol, so just take that. And if you could just avoid any straws or anything for the next few days, just because that will result in a dry socket, and we do not want a dry socket, of course. And lastly, if you can avoid brushing in those areas of the extractions for the next 3 days. Any questions or concerns?
Can I eat normally or?
So just for the time being right now, just try to eat softer foods.
Okay.
Any other questions?
No.
Perfect. So I'm going to book you in to come back next week for an appointment, and I'm going to give you this business card here. So if you have any concerns or you feel that something feels like there's an emergency or anything, feel free to contact me.
Okay, thank you.